is Nick Nielsen here with Trey Jones. As a certified financial planner, it seems like two of the questions that people have before retirement are, how do I take Social Security, and what am I going to do about Medicare? A man must know his limitations. You can't be an expert in all subject matters. Trey Jones knows Medicare, and he can answer our questions. So there's a lot of questions. We've kind of zeroed in on maybe 4 or 5 questions that we're going to talk about today. And I think the first one that comes to mind is, I'm still working. Shouldn't I just stay on my employer plan?
Yeah, that's something that we talk about with our clients, our prospective clients all the time. Very, very common these days for someone to either continue working beyond their Medicare eligibility, beyond age 65, and have access to their employer's plan or the employer's plan of their spouse. And so we know that most folks are going to become eligible for Medicare when they turn 65, just by virtue of having paid taxes their entire life. But now, if they have access to that group plan, what they'll usually want to do is just compare the two, compare the employer's plan to whatever is available in the Medicare market. And so the way that they'll do that is they'll look at a couple things specifically. First, probably the most obvious, is the price. What's the monthly premium? Next, are there any restrictions on how you receive your care and who you can receive your care from? In other words, are there provider networks? So the two most common provider networks are HMOs and PPOs. Most people have had one or both at some point in their life. Next, you want to look at the annual deductible. For the under 65 employer plans, it's not uncommon for there to be an annual deductible requirement of somewhere between $1,000 and $5,000. And then after that, you want to look at your cost sharing. So how much is it going to cost you to go see your primary care doctor? What's the copay? What's the copay to go see a specialist? What are the co-insurance requirements for different procedures if you go in the hospital, so on and so forth. And so those are the things you want to look at to make a good, objective, usable comparison between the employer's plan and then what's available in the Medicare market. And so that's something that a lot of folks will do. With the Medicare options, very often you can set Medicare up where there really are no networks, and Medicare itself is accepted just about everywhere in the country. So
I know, I think of my parents and some of the questions they asked, as they were preparing for retirement, and it seems like one of the number one question is, what are my options? And then, can I keep my own doctor?
Yeah,
that's they've developed relationships with doctors or nurses at a specific office over the years, and those relationships tend to be sacred to them.
Yeah, they want as little change as possible, and I completely understand that. So, I think it'd be useful to provide a little bit of context on Medicare and then talk briefly about the options, because what a lot of people find themselves doing is, because they're receiving so much marketing, so much direct mail, it's all over TV, they've got people calling them, they'll end up making a decision just based on the Medicare marketing. That's not what you want to do. So as we said a minute ago, most folks are going to be eligible for Medicare when they turn 65. Now, when I say Medicare, that does not actually have anything to do with private insurance. That's your basic federally provided Medicare benefits. And there are 2 parts to that, Nick. There's Part A, which is the hospital coverage, and then there's Part B, which is the medical coverage. And those are really the only 2 parts of Medicare provided directly by the federal Medicare program. Everything else, regardless of how official it sounds, Part C, Part D, Medicare Supplement, Medicare Advantage, all of that stuff is private insurance, and it'll be marketed and sold to you by private insurance companies. And so you got Parts A and B of Medicare, and it's pretty good coverage. I mean, it's pretty widely accepted. You can use it almost anywhere. Most of the folks that I work with are going to put something in place to work with Medicare. And the reason for that is, while it is widely accepted, there are some pretty steep out-of-pocket requirements in Parts A and B of Medicare. They're called coverage gaps. And so all the folks that I work with at some point in the not-so-distant future, really if they're not already, they're going to be on a fixed income. And what they do not want to have to deal with are high, unpredictable out-of-pocket costs. And so essentially you've got 2 options. There are 2 basic product types when you're talking about products you can use with Medicare. There's Medicare Advantage and there's Medicare Supplement. And the caveat here is you can't have them both. And they're very different in how they work with the Medicare program.
Trey, I think it would be great to go through the difference between Medicare Supplement and Medicare Advantage. whenever I look at something, it seems so confusing, and then you talk about it, it makes complete sense. So for all the listeners out there who are probably just as confused as I am, give them a high-level overview of kind of supplement versus advantage.
Yeah, sure. So all of the marketing that you see, mail, your junk mail, your people calling you on the phone, it doesn't really matter what the medium is. They're all either going to be advertising a Medicare Advantage plan or a Medicare Supplement plan. Those are the two basic product types that you can use to kind of limit your risk to those steep out-of-pocket requirements in Medicare, the coverage gaps. One is Medicare Advantage, the other is Medicare Supplement, and you can't have them both. So the Medicare Advantage plans, we'll talk about those first, they're the ones that are going to closely resemble your employer's plan. Okay, so and they're very easy to recognize. These are the plans that will reference some type of provider network. So these are going to be your HMOs, your PPOs. If you see any type of provider network referenced, you can be pretty sure you're looking at a Medicare Advantage plan. So here's how Medicare Advantage works, just the basic layout. When you enroll in a Medicare Advantage plan, your relationship with the federal Medicare program is going to change a little bit. So specifically, Medicare will no longer provide you directly with your Medicare benefits. The idea behind the Medicare Advantage program is, let's see if a private insurance company can do a better, more efficient job providing the Medicare benefits than the Medicare program. And sometimes that works, and as you can imagine, sometimes that does not work so well. So when you enroll in one of those plans, the federal Medicare program is going to pay whoever the insurance company is you bought your Medicare Advantage plan from a set monthly dollar amount. It's usually between $800 and $1,000. And then in exchange for that monthly payment for Medicare, your Medicare Advantage plan becomes the responsible entity for providing you with your Medicare benefits.
Transferred that risk to that private insurance company.
Exactly. And so that means the Medicare Advantage plan, they get to set your share of the cost. They get to tell you what your co-pays will be when you go to see your primary care doctor, specialty doctor. They get to tell you what your co-insurance percentage is going to be for any procedures. They get to tell you whether or not you're going to have a deductible. So essentially, they're in complete control of how you access your benefits and who you can go see.
Perfect.
That's Medicare Advantage,
Okay.
kind of in a nutshell. Yep. So your other option is
Supplements.
is the Medicare Supplement plans. Yeah, and these plans are also pretty easy to recognize. They're going to be your lettered plans. Okay, so F, G, N. Anytime you see plan followed by a letter, you're going to be looking at a Medicare Supplement plan. Sometimes you'll see these referred to as Medigap, and there really are a couple big differences right out of the gate. So one, there are no networks with Medicare Supplement plans, and that is probably the biggest driver to these plans. Most folks have not, up to this point, up to turning 65, really have not had an opportunity to buy coverage where there are no network restrictions. So there are no networks with Medicare Supplement plans. You can see any doctor, specialty doctor, urgent care hospital in the country, the only qualifier being that provider must accept Medicare, which the overwhelming majority of providers in the country do. So that's the first, no networks. The second big difference, and this is very important, So when you go to see your doctor or you have to go to the hospital, whoever the provider is, that provider is not going to bill your insurance company. They're going to bill the federal Medicare program directly. That's actually why there are no networks. I mean, federal Medicare program is nationwide. That means the entity that gets to make the coverage decision on your health care in retirement is a nonprofit federal entity as opposed to a for-profit insurance company. So here's how it works. They're going to bill Medicare directly. Medicare will make the coverage decision and then pay its share of the cost directly to whoever the provider is. Okay? Then Medicare will bill the insurance company from whom you've bought your Medicare Supplement plan. And just an important note here, don't think of it as an invoice. Think of it more like a payment order. There's no smiley face that says, please remit payment at your earliest convenience. It is a payment order. So there's no one at the insurance company that receives that payment order that can say, I don't think we want to pay this. They don't have a choice, which is, again, that's something that a lot of folks have not had an opportunity to have. So it's interesting.
So I'm learning, hopefully just like many of you out there are, and I'm taking notes. Trey, we meet with people who are 67, 68, 70, right? They've already made that initial decision, right, on Advantage versus Supplement, or you mentioned the lettered plans, and there's several different letters that are out there. One, can people make changes to their initial election And two, are there any, red flags or any indicators that say, hey, if you have this type of plan, it's really worth sitting down with someone like yourself and taking a deep dive and seeing if there's something better?
Yeah, absolutely. So, and this is another distinction between the Medicare Supplement and the Medicare Advantage plans, Nick. So the Medicare Advantage plans, they are basically going to be funded by the tax equity that you've paid into the Medicare program. So Medicare is going to pay a set dollar amount every month to the Medicare Advantage plan. And that's where that comes from. It's from the taxes that you've paid into the Medicare program throughout your life. So they can't accept your tax money and not you. So the Medicare Advantage plans, for the most part, they can't look at your health. They're going to have to accept you. There are a couple kind of outlying conditions: Lou Gehrig's disease, end-stage renal disease, which is kidney failure that's permanent, that could preclude you from being able to enroll in a Medicare Advantage plan. But for the most part, they're going to have to accept you. Not so with the Medicare Supplement plans. Okay, so there are two demands you can place on an insurance company, but it's either or. You can tell them you have to accept everyone who applies, or you have to pay every claim we send you. If you tell them they have to accept everyone and they have to pay all the claims, they're going to be bankrupt in pretty short order. So with the Medicare Supplement plans, they have some input as far as who they want to enroll. Okay, so they're essentially allowed to ask you health questions. There's
similar to like a life insurance application.
Right. There's a section of the application. There are usually 20 or 30 health questions you're going to have to answer, and then they're going to follow that up with a report. They're going to pull a report on you from the Medical Information Bureau, which will basically give that insurance company your health history for the past 5 years. And if they see something that they don't like, they don't have to enroll you.
But once they've enrolled you.
Well, yeah, right. So once they've enrolled you, I mean, they can never single you out. Hey, this Nick Nielsen guy, he's sick, he's costing us too much money. Let's either raise his rate or drop him. They can never do that. But first, and this is also pretty important, you're going to be given a 6-month window, and you will only get that 6 months once in your life. The reason it's important is because inside of that 6-month window, no insurance company that would sell you a Medicare Supplement plan can look at your health. They have to take you, period. You don't have to answer the health questions. They're not going to pull a health report on you. They're going to assume you're perfectly healthy. They're going to accept you and give you the most competitive rate in your market. Now, once you're on the plan, as we just said, they can never go back and say, this guy's costing us money. Let's see if we can get rid of him. They can never do that. Now, you will receive small rate increases once you're 66, 67 on an annual basis.
But that applies to everyone.
That
They're
applies
not singling out.
No, that applies to everyone.
People.
Exactly, and that's going to happen with every insurance company everywhere in the country.
Okay.
Yeah. So the kind of the point is, if you have any health issues, then that's something to consider, because something that this turns out to be a little bit of a trap for a lot of folks. They're healthy when they go on to Medicare, and so they go and basically find just the cheapest plan possible. And I understand the reasoning there. But if something happens, when something happens with their health, they start looking around, and maybe their family member or neighbor has got a Medicare Supplement plan, and they're happy with that coverage. Just for example, a Plan G, no networks, annual deductible of $185. That's what it is at the time of this video. After which, there are no copays or co-insurance requirements at a doctor or hospital. So they see that and they compare that to what they're paying. And now they want one, so they'll call a broker like me and say, "Hey, look, something's happened with my health, and now I'm having to pay a little more than I thought I would. Can you talk to me about a Plan G or a Plan N or any Medicare Supplement plan?" Unfortunately, at that point, they're beyond that 6-month window, and so they've got to go through medical underwriting.
Right.
Yeah, and it's sad because a lot of those folks were never told about these underwriting requirements, or so they didn't know.
I think whether it's your financial plan, you want to make educated decisions, right? And you don't want to just fall victim to some marketing ploy or some slick sales presentation. You really need to do your homework with a professional like yourself to make sure that you've done your analysis on maybe not what's the cheapest plan, but what's the best plan long term. You don't want to get stuck in that window where you're only thinking about the best plan over the next 12 months.
Well, as long as you have all the information, there really is no wrong answer. I mean, it's tough to make a bad decision if you have all the information. This size is not one size fits all. these products are not one size fits all, rather. So, but yeah.
Are there any known changes coming to Medicare that would make someone really want to look closely at their current plan, especially if they are healthy?
Yeah, so there's a piece of legislation that passed Congress, I believe it was April of 2015. If anyone wants to research that law, it's called MACRA, M-A-C-R-A, the Medicare Access and CHIP Reauthorization Act. And essentially what that's going to do is stop the inflow of new Medicare beneficiaries to Plan F. And that'll start January 1st of 2020. So if you have a Plan F, it may be a good idea to get with a broker, someone that can look around and shop that plan for you, or look at going to a Plan G. The only difference in Plan F and G is that G requires you to pay that annual deductible, the $185, but annually the premiums are usually $300 to $400 less, so it's worth a look. Yeah.
And with Plan F, the potential downside there is there will not be new applicants coming in to that program, correct? So
that's exactly right, Nick. So Medicare supplement insurance is the most basic example of insurance I'm aware of. All it is a very large group of people who've chosen to pool together their financial resources, so no one person has to face a bankruptcy or some type of financial calamity if they get sick. Okay, so the more people there are to spread the risk over and the cost over, the better. It helps if there are younger people coming in that are usually healthy. They're going to pay their monthly premiums but not have a lot of claims against the coverage. When you cut off the inflow of those younger, healthier folks, what you see is the annual rate increase getting a little bit steeper. When that happens, and we saw this happen years ago with Plan J, when that happens, the folks who have Plan F that are healthy enough to pass underwriting, they're probably going to leave and go to a Plan G, and that's just going to make those annual increases even more pronounced.
Because the people who are left in F could potentially be older and unhealthy. Trey, we've talked about a number of things today. I've learned a lot, as always, being around you. One of the things that we always talk with clients about is long-term care. A lot of times clients think that Medicare is going to pay for all of their long-term care expenses. So just at a high level, what does Medicare cover for long-term care, or does it?
So, well, with Medicare or with long-term care, you're going to be talking about days. You said the average stay is 3 to 4 years.
Yeah.
Medicare is going to cover your stay in a facility for up to maximum 150 days. Okay, so there's the first 60 days. There's a deductible. It's $1,364, and just as a side note, that's not an annual deductible. That is a per 60-day benefit period deductible that you could be asked to pay more than once during the course of a year. So there's that for the first 60 days. Then for days 61 through 90, there's a per diem of, let's see, it's $341 per day. Now this is with Part A Medicare. Okay. Now days 91 and beyond, these are referred to as your lifetime reserve days. You get 60 of them in your life. They're going to be $682 per day. So that's up to day 150. That doesn't, and that's not even a year. So
and 680 a day gets pretty pricey.
That's pretty steep. So Medicare is not going to cover any long-term care, unfortunately. So, but that's why we have folks like you that are experts in long-term care, because it's, for a lot of folks, it turns out to be a pretty necessary product to have.
Right. So I think really, a comprehensive health care plan, understand what plan is right for you, Medicare Supplement versus Medicare Advantage, and then long-term care. Right? It all works together to try to eliminate that barbarian of healthcare costs in retirement.
Yeah, you just try to avoid the spikes. You want it nice and even, something you can plan for.
Exactly. Well, Trey, I appreciate you coming by. It's always a pleasure. I appreciate the education.
Pleasure to be here.
A man must know his limitations. I'm so glad we have experts like Trey. Thank you.